Welcome to today's video, where we'll be diving into a less common, but important topic: Acyclovir stones. These urinary stones are a potential complication for individuals taking Acyclovir, an antiviral medication. We'll explore what they are, how they form, and what can be done about them. So, what causes Acyclovir stones? The primary culprit is, of course, Acyclovir itself. This medication is used to treat viral infections like herpes simplex and varicella zoster. The formation of these stones occurs when Acyclovir, particularly at high doses or in individuals with impaired kidney function, precipitates out of the urine and forms crystals. Dehydration also plays a significant role, as concentrated urine increases the likelihood of crystallization. Now let's talk about the pathophysiology. When Acyclovir is administered, it's partially excreted unchanged by the kidneys. If the concentration of Acyclovir in the urine exceeds its solubility limit, crystals start to form. These crystals can then aggregate and grow, ultimately forming stones. The stones can lodge in the kidney's ureters or bladder, causing obstruction and inflammation. Epidemiologically, Acyclovir stones are considered a relatively rare occurrence. However, the exact incidence is difficult to determine, as many cases may go undiagnosed or be attributed to other causes of kidney stones. The risk is higher in patients receiving high doses of intravenous Acyclovir, particularly those with pre-existing renal impairment, reduced urine output, or those taking other nephrotoxic medications concurrently. The signs and symptoms of Acyclovir stones are similar to those of other types of urinary stones. These can include flank pain, which is pain in the side or back, hematuria, which is blood in the urine, dysuria, or painful urination, and urinary frequency or urgency. In severe cases, a blocked urinary tract can lead to kidney infection, fever, and chills. Diagnosing Acyclovir stones typically involves a combination of patient history, physical examination, and imaging studies. A urinalysis can reveal the presence of Acyclovir crystals. Imaging techniques, such as a CT scan or ultrasound of the kidneys, ureters, and bladder, are used to visualize the stones and assess the degree of urinary obstruction. It's crucial to differentiate Acyclovir stones from other types of kidney stones through careful evaluation. Acyclovir stones are primarily classified based on their composition, which is predominantly Acyclovir. There aren't distinct subtypes beyond this chemical composition. The size and location of the stone is the more important factor when considering treatment. Treatment and management of Acyclovir stones focus on relieving pain, removing the stone, and preventing recurrence. Initial management often involves pain relief with analgesics and increasing fluid intake to promote stone passage. If the stone is large or causing significant obstruction, more invasive procedures may be necessary. These can include extracorporeal shockwave lithotripsy, ureteroscopy with stone extraction, or rarely, percutaneous nephrolithotomy. It's also essential to adjust or discontinue Acyclovir dosage under medical supervision, if deemed necessary. Prevention of Acyclovir stones is crucial, especially in high-risk individuals. Key preventive measures include adequate hydration to maintain dilute urine, adjusting the Acyclovir dosage based on kidney function, and monitoring urine output during intravenous Acyclovir administration. Alkalinization of the urine may also be considered in some cases to increase Acyclovir solubility. The prognosis for individuals with Acyclovir stones is generally good with prompt diagnosis and appropriate management. Recurrence is possible if preventive measures are not followed. Recent research has focused on improving Acyclovir formulations to enhance solubility and reduce the risk of crystallization. Studies are also exploring the potential role of agerpes to prevent stone formation in high-risk patients.